Hello, everyone. So, I know that pregnancy can be scary, whether you're a first time mom or you've done this a few times. The changes that our bodies go through and the emotional and social and psychological aspect of it is also connected and can be really challenging. Not knowing what to do and not knowing what to expect when your body changes, what's normal, what's not normal. Should I be exercising? Should I not exercise? It can all be so overwhelming. My name's Christine. I'm a pelvic floor physical therapist, and I'm going to break down each trimester, the hormonal changes that are happening, stages of labor, and whether or not exercise is safe during pregnancy and what the exercise recommendations actually are. Let's go ahead and get started. So there are 3 trimesters during pregnancy, and there's actually a 4th one that I hear a lot of pelvic floor physical therapists talk about, but no one else that much. So I'm going to talk about all 4. So the first trimester is 0 to 13 weeks. During this time, the uterus is still within the bony pelvis, and some symptoms you might have are fatigue, morning sickness, some mood fluctuations. This is also the part where the highest rate of miscarriage happens, about 20%. So oftentimes, this is where people are not sharing that they're pregnant because they have the fear that a miscarriage may take place. Trimester number 2 are weeks 13 through 26. And at this point, many women will notice an increase in their energy. The placenta starts to grow. The uterus moves out of the bony pelvis. And the fun fact is this is the time where mommy brain starts to develop because the brain will actually shrink a little bit, which is really cool. So when moms are like, oh, I have mommy brain, it's not just a made up thing. It's a real thing that happens with our bodies where your brain will shrink a little bit and you might be more forgetful or make mistakes that you typically wouldn't make. Now, 3rd trimester is weeks 27 through 40, and this is where the uterus starts to rise up into the diaphragm, and you might notice it's harder to breathe, harder to catch your breath. You're more tired because a lot of the blood is going to the growing fetus and to help your baby grow. You might also notice some swelling in your feet, which is totally normal if when you sit down and elevate your legs, it goes back down. Now, 4th trimester are the 12 weeks postpartum when you actually give birth. And this is a really essential part to returning to your daily life and ensuring that you're physically and psychologically safe and healthy. And we're going to get more into that at the end of this video. So there are some major hormonal changes that take place during pregnancy to help support mom's health and baby's health as well. We're going to go through the biggest ones, but there are so many things that happen. So estrogen is produced at 30 times the normal rate, and this is what causes your breasts to grow and your uterus to grow. It also is responsible for increased in muscle and joint laxity during this time. And it helps stimulate progesterone so that your immune system can be supported. Now, progesterone helps thicken the uterine lining for implantation so that you can actually get pregnant. It increases fat storage, and it helps prevent premature contractions by relaxing smooth muscle. So smooth muscle are pretty much your organs. And if smooth muscle is more relaxed, that means you might be a little bit more constipated because our colon is a smooth muscle and it's not moving as much. So that's why moms might feel a little bit more constipation during this time. It also suppresses milk production so that you are not producing any milk while you're pregnant, and it can have an effect on our mental clarity and focus. So glucose levels also rise in order to provide more energy for the mom and the baby. But if that glucose is not used, it may develop into gestational diabetes, which is why that is something that's checked for throughout your pregnancy to ensure that you don't have it, because there is research that supports if a mom has gestational diabetes, it can increase her risk of developing type 2 diabetes later on. Now, our heart also changes. It gets bigger and it moves up and to the left a little bit more. Your resting heart rate increases by 10 to 20 beats per minute, and your blood volume increases by 30 to 50%. What does this actually mean? So when you have that pregnancy glow, it's because you're getting more blood flow to your face. And the reason why I personally never look at heart rate as a measure of how intense a pregnant woman is during exercise, because your heart rate's 10 to 20 beats faster. So this is inaccurate. So a better way to measure how intense your exercise is while you're pregnant is to do a rate of perceived exertion scale, where 0 means I'm doing absolutely nothing and 10 means I'm doing the most intense exercise in the world, because your heart rate will be inaccurate during pregnancy. When it comes to cardiovascular stuff, your blood pressure should never increase during pregnancy. It either stays the same or slightly drops. So if you're having any major changes in blood pressure, please talk to your doctor. Let's clear up some confusion. It is absolutely safe in most cases to be exercising during pregnancy, and it's actually recommended. If you're healthy and have no contraindications and your doctor did not tell you otherwise, then it's not just healthy to exercise, but it's actually very beneficial for mom's health and for fetus development and cognitive health. Exercise not only helps you during your pregnancy, it helps you during childbirth, and it helps you with postpartum recovery. The benefits are not just physical, but they're psychological as well, because moms that are exercising have decreased risk of postpartum depression and anxiety. So if you can maintain your exercise routine, I would highly recommend maintaining it. There are some current recommendations that say pregnant moms should be exercising 1 to 2 times a week for an hour of strength training. And this can look like upper body workouts, lower body workouts, core, pelvic floor, and a mix of all of those is recommended. The intensity should be moderate. So remember, we're not using our heart rate because during pregnancy, heart rate increases, but you can use a scale of 0 to 10. How difficult is this exercise? And try to be somewhere in the middle. Of course, adding cardiovascular exercise and mobility work is really important. So going out on walks, cycling, running if you have ran before your pregnancy and want to maintain it and can do so safely, then you can definitely continue those. And mobility work is really a huge focus during your 3rd trimester, so that when you're giving birth, you have a decreased risk of tearing and you have an easier time if you are choosing to have a vaginal birth. If you're not sure where to start with exercising, I upload weekly videos on here, and I have the pelvic playground, which you can try for free for 7 days, that has a variety of different workouts and workout programs. So there are 4 stages of labor. Stage 1 is progressive onset, and this lasts anywhere from 12 to 19 hours. New moms and first-time moms have a longer labor time than those who have already given birth before. This can be slower if moms are really stressed or if they're sedated too early. Usually epidurals are given at about 4 to 5 centimeters of dilation. And within this first stage, there are substages. So the latent phase is 0 to 4 centimeters of dilation. At this point, contractions are mild and they're regular, happening every 10 to 30 minutes. Then progressing to every 5 to 7 minutes, and they last about 30 to 40 seconds each. From there, it goes into the active phase, which is from 4 to 7 centimeters of dilation. Contractions get a little bit closer together, so they happen every 2 to 3 minutes, and they last about 60 seconds. And then the transition phase, where you go from 8 to 10 centimeters being you are fully dilated. You have more intense contractions, and they're happening every 1.5 to 2 minutes, and they last anywhere from 60 seconds to 90 seconds. During this first stage of labor, moms are usually able to walk and change positions, which can help with progressing labor. Stage 2 is when mom is fully dilated, and the mom starts to feel the urge to push with each contraction. This is when the baby's head reaches the pelvic floor and they start crowning. If an episiotomy, which is basically cutting through the muscles, happens, this is the stage where that would happen. And this ends with baby being delivered. The 3rd stage is the delivery of placenta, which happens anywhere from 5 to 30 minutes after birth. And the uterus gently contracts again and expels the placenta. You might have the doctor or nurse do some gentle traction to help with assisting that separation. of the placenta from the uterine lining. And then lastly, the fourth stage is immediately postpartum recovery. Moms are usually monitored for about 4 hours to ensure that they're healthy and safe and doing okay. Pregnancy is a powerful and transformative time in women's lives, and it can also be really scary and confusing because your body's changing so much. If you have any questions, you can always send me a message, or if you're interested in learning more about pregnancy, maintaining your health, and postpartum recovery, follow along and join my pelvic floor community if you are interested. If you like this video, share it with someone that's expecting, like, comment, and subscribe. Take care, and I will see you next time. Bye.